Jobco International welcomes you to Community Health Volunteer Training, Module 1. Let's start with the Lesson 2, Community Health Strategies. In this lesson, we shall have 4 sections. That is Kenya Essential Package for Health, Life Cycle Approach, Community Health Volunteer Responsibilities, Facilitative Attitudes for Community Health Volunteers. By the end of this unit, community health volunteers should be able to understand the basic concepts in care of a mother before pregnancy, during and preparation for childbirth, and after delivery. As community health volunteer, one should be able to demonstrate skills on maternal nutrition. Let's start by Kenya Essential Package Health, Section 1. Introduction. Integrated collection of cost-effective prevention measures to address common diseases, injuries, health risk factors. Equity. All have equal to opportunity services. Access. All can reach health services. Effectiveness. The right health services should be given. Efficiency. Services are delivered in the right way. Partnership and resource mobilization. Let's go to National Health Sector Strategic Plan 3. This organizes health services into our 4 tiers of service delivery on the cycle of human development. The Kenya Essential Package divides the community by age groups because each age group has different health needs, and the age group are preferred to as age cohort in the community health strategy. Tier 1 is community health services. Tier 2 is primary care services. Tier 3 is county health services, and Tier 4 is the national referral services. Kenya Essential Package age cohorts has specific interventions are focused to each age cohort and their unique needs. Pregnancy and newborn up to 28 days focuses on health service in the community, which are sensitization on early recognition of danger signs, preparation of birth, frequent follow-ups, and verbal autopsy. Then health services at the health center and dispensaries are focused on antenatal clinic and prevention of malaria. It focuses on voluntary counseling and testing and also on referrals. It also focuses on basic emergency obstetric care, post-abortion care, and referral services. We also focus on maternal death review. Health services in the community. This will focus on the childhood 29 days to 59 months. This is sensitization on care household care practices, care of the sick child at home, care seeking and compliance, promoting growth and development. Let's look at health services in the community. It's through supporting family on feeding for infant and young child. We ensure that school enrollment is done and attendance and support. Ensure that support for behavior formation and good hygiene is observed. Let's look at the healthcare services at health center and dispensaries. The following are observed. There is immunization, growth monitoring, treatment of common conditions like pneumonia, malaria, and diarrhea. We also do screening for early detection of health problems. Let's look at health services in the community for children and youths of 5 to 19 years. We do support behavioral change for prevention of HIV, sexually transmitted diseases, early pregnancies, and substance abuse. We also look at supply preventive commodities. Let's also look at health services at health centers and dispensaries. We will give basic youth-friendly services. We give syndromic management on the sexually transmitted infections. We also do laboratory diagnosis for common infections. Let's look at adulthood 20 to 59 years health services given in the community. We do support behavioral change for prevention of communicable diseases and lifestyle diseases. We do supply and preventive commodities. We do home-based care. We check on compliance for treatment on ARVs and tuberculosis. And also we do promotion of gender and health rights. Let's look at health services at the health center and dispensaries for adulthood of 20 years to 59 years. The voluntary counseling and testing and VLT and support groups are done. We give syndromic management of the sexually transmitted infections. We also do laboratory diagnosis of common infections. Let's look at the elderly, 60 years and above. Let's see what they're given at the health services in the community. We support behavioral change to reduce harmful practices. We do home-based care for the elderly. We do community-based rehabilitation for the elderly. Let's look at health services at health centers and dispensary offered to elderly 60 years and above. Management and rehabilitation of clinical problems is done. Screening of early detection of diseases is done. Then across all cohorts, the following are done at the following health services is in the community. Home visits are done to all. Referral services is done to all cohorts. And community dialogue is done for everybody in the community. Also, health action days should involve all cohorts in the community. Then health services in the community that are done to all cohorts. Promotion of healthy diet. They support claiming health rights. There is verbal autospay. There is promotion of safe water and sanitation and hygiene practices. There is diagnosis, treatment of common conditions. There is stock of essential drugs. There is referral services. Management of clients' satisfaction is done. And there is oversight of community health volunteer activities. There is participation in community dialogue. Life cycle approach. These are basic structure of community health strategy. Community Health Committee. This is the CHC. It governs body for the community unit consisting of representatives from different groups and villages who provide leadership for managing level 1 service and activities in the community unit and build partnership with stakeholders. We have community health extension worker who is a CHV. Their work is health or development workers support community health volunteer and community health committee technically through supervision and mentoring and strengthening linkage between community unit and higher health systems. We have the community health strategy guidelines. Guideline 1 is guiding the community on how to improve health and prevent illness by adopting health practices, treating common ailments and minor injuries as first aid with the support and guidance of the community health extension worker, stocking the community health volunteer kit with supplies provided through a revolving fund generated from the users. Number 4 is referring cases to the nearest health facilities. They also promote care seeking and compliance with treatment and advice. They also do visits to homes to determine the health situation and initiating dialogue with household member to undertake the necessary action for improvement. They also promote appropriate home care, for the sick with the support of the community health extension workers and level 2 and 3 facilities. They also participate in monthly community unit health dialogue and action days organized by the community health extension workers and the community health committees. They also are available to the community to respond to questions and provide advice. They also should be an example and model of good health behavior in the community. They should motivate members of the community to adopt health promoting practices. They should be organizing, mobilizing, and leading village health activities. Finally, they should be maintaining village registers and keeping records of the community health related events. They should be reporting to the community health extension worker on the activities they have been involved and any specific health problems they have encountered that need to be brought to the attention of the higher levels. Activities of the community health volunteers are, they should do house visits. This is to provide opportunities for community health volunteers to learn to sit alongside and experience firsthand what the family is experiencing. They should facilitate neighborhood conversations. The conversations taking place in homes quickly expand to include other households through relationship connections between the local people. They also should hold community dialogues. The community health volunteer plays a major role in collecting of information that is summarized and discussed during quarterly community dialogue days. Number 4, a community health action day should be held through the help of the community health volunteers. The community health member hold collective responsibility on timeline for taking health actions based on the nature and magnitude of the identified health problems. Number 5, management of community-based health information. Community health volunteers collect and analyze the community-based health information together with community health committee and community health extension worker and support the community to see and think together. The community health volunteers also should be doing the referrals. Close attention to families and proper identification of danger signs make it possible for the community health volunteers to refer those who need professional health services in good time. Facilitative attitude. As you work as a community health volunteer in our communities, it is important to remember what you believe about others. They also have strengths, and how will you behave as we enter the communities. 1. Believe people have the strength to respond to their challenges. Use different methods of think, learn and share together with people. Help people to review their strengths and come up with solutions for their challenges by themselves. Connect people with others. Try to make people feel comfortable and confident. Stay together with people even after workshops or trainings. Help people to assess their achievements by themselves with different methods.